After the foundation, this is a specialist training, either medical or surgical or gynae or anesthetics. And the first part is called the Academic Clinical Fellowship. It can be at the level of ST1, ST2, ST3, or ST4. And then the second part is called the Clinical Lecturership, which starts at the level of usually ST5 and above. But it's mainly based on when the candidate holds the PhD. There are some other fellowships like research funding for but without training, like postdoctoral award, personal training, in practice fellowship. These are like funding for research but without training. After that, the candidate finishes the CCT, which is a very highly recognized certificate all over the world. And after the CCT, there are multiple choices here for the candidate. The candidate can choose to just continue as a researcher and apply for something called the research professorship, and they can become like a full-time research professor in the university, no clinical work. They can apply for senior lecturer or senior clinical fellowship. They still combine some of the consultant time in and do research. And they can just change to completely clinical pathway, and they just keep the CPD, the continued professional development. CPD is a very important thing in the UK, to keep yourself professionally developed. And the last thing, you can become a full-time clinical consultant without any commitments to the university. You don't have contract with the university, but you can still do some research sessions out of your clinical time. This is based on how you agree with the hospital you work in. So these are the career perspective. As we said, you can continue combining your academic clinical career. You can, after the ACF job, by doing clinical lecturership. After the ACF job, you can choose to take time out of program for a PhD, and after the PhD, you can apply for clinical lecturer, or you can go back to pure clinical training. As we said, you can continue after the ACF as a clinical trainee, whether or with or without PhD, as you choose. And after the CCT, you can choose to become only research faculty after the CCT without any clinical work. And you will get paid by the university.